Barbados Prime Minister Mia Mottley and other Caribbean leaders participate in the 73rd World Health Assembly. Mass protests in Port-au-Prince, Haiti on Flag Day. And anti-government protests in Ecuador reject a new law which could remove workers' protections. Welcome to Telesur. I'm Carla Gonzalez, and this is from the South. The 73rd World Health Assembly is taking place with world leaders convening virtually for the first time due to the COVID-19 pandemic. The ambassador of the Bahamas, Keva Bain, has been elected to the presidency of the assembly.
We convene the 73rd Assembly during an unprecedented time in history when the global community is faced with negative health, social, and economic effects of the spread of the coronavirus. And the Assembly convened virtually, bringing together participants from across the globe. The public health community has faced challenges in the past. Global health issues transcend national boundaries and governments and call for action on the part of the global forces that determine the health of people.
As we request assistance to address COVID-19 in the Bahamas and in other small island states, we urge the international community to adopt and to appreciate a broader understanding of the developmental levels and the unique local circumstances in our states.
The Prime Minister of Barbados, Mia Mottley, spoke about the situation in her country and in the CARICOM region.
Our CARICOM heads of government adopted a whole-of-government and a whole-of-society approach. In addition, we reached to our Caribbean neighbor Cuba and received hundreds of doctors and nurses to help us. I take this opportunity to thank our brothers and sisters in Cuba and the government of the Republic of Cuba in particular for its unswerving assistance during this pandemic. It has been palpable and clear to all of our population. So, our CARICOM family banded together to lock down and ride out this first wave. And it has been a long and treacherous wave. The closing of our borders and the trebling of unemployment and the reduction of our government revenues by half have created grave challenges for many of us. Similarly, the psyche of people in our hemisphere has been disturbed. For the majority of persons under the age of 70 in the Caribbean, many of whom have never had to confront grave challenges, the world appears to be on autopilot. They wonder who is in control and where is the leadership? Where is the global cooperation that they so expected? And for too many of our citizens globally, life has become a game of roulette betting on numbers and colors and ignoring the science that needs to underpin our actions.
Mottley said that the region faces additional challenges with just 2 weeks to go before the hurricane season begins.
Even when our circumstances deteriorate, there has been no review that takes into account the inherent vulnerability to which we are exposed and which prevents us from being able to access critical money or goods. In addition, the use of certain proxy criteria to access technologies, medicines, vaccines, or concessional funds would exclude vulnerable countries such as ours in the Caribbean, some in Latin America, and even in the Pacific. Why? Because we are using criteria that are more relevant to fighting problems that have little or no relevance to our current vulnerabilities and challenges. For example, we are less than 2 weeks away from the beginning of the hurricane season. Tropical Storm Arthur has already formed off of the Bahamas, well in advance of that start. Many of us are already confronting droughts and the presence of sargassum weed as a result of the climate crisis, and it is wreaking havoc in our societies.
Cuba's Minister of Public Health described the country's experience in the COVID-19 fight, saying that the crisis turned into an opportunity for global solidarity. He said the U.S. blockade failed to stifle medical collaboration.
This was not prevented by the genocidal blockade imposed by the United States against Cuba, which has been cruelly stepped up, nor the attempts of the government of this country to discredit and hinder medical cooperation from Cuba. President, no country can face this crisis alone. There needs to be a world-level response based on unity, solidarity, and multilateral cooperation. Cuba reiterates to the WHO and its member states its willingness to cooperate and share our modest experience. Thank you.
South African President Cyril Ramaphosa said Africa is extremely vulnerable to COVID-19 and that it is the poor worldwide who suffer the most. He said all nations must have equal access to medical technologies and stressed the importance of international solidarity.
For its part, South Africa is participating in several research initiatives. We must ensure that there is equitable access to medical equipment, technologies in all respects. In this final decade towards the attainment of the Sustainable Development Goals, we must press ahead with our goal of making universal health care a reality for all the people of the world, and no one must be left behind. The virus has demonstrated the essential value of universal health coverage, and this is where we need full solidarity.
The Director General of the World Health Organization defended the body's response to the novel coronavirus. He said the world does not lack the resources to make it safer from pandemics, but needs to use the tools in its possession.
I'm calling on all nations to resolve that they will do everything it takes to ensure that the 2020 coronavirus pandemic is never repeated. I'm calling on all nations to invest in strengthening and implementing the many tools at our disposal, especially the global treaty that underpins global health security, the international health regulations. To be successful, we must all commit to mutual ownership and accountability.
The Minister of Health in Argentina, Ginés González García, says that the country is prepared to collaborate on the global eradication of the coronavirus.
Argentina wishes to indicate its interest in moving forward with any regional or global initiative designed to strengthen measures to combat the pandemic. And any initiative helping us to get access to the results of research into treatment, vaccines or medical products. What we need is for states to encourage work to guarantee access to knowledge of these global public goods through free licenses or sufficiently accessible ones for societies all over the world.
We're taking a short break now. Don't go away. Welcome back. Let's continue with news. For the second year in a row, the Cap Haitian Flag Day Parade has been cancelled. In 2019, the event was shut down due to safety issues caused by a political crisis. And this year, the novel coronavirus has prevented the celebration. The first purely Haitian flag was adopted on May 18, 1803. The chief of the Black Rebels, Jean-Jacques Dessalines, and leader of the Mulattoes, Alexandre Pétion, stopped fighting alongside the French in February. Dessalines removed the white band from the French flag used in Haiti during the French rule, creating the first Haitian flag, a symbol of alliance of the blacks and the mulattoes in their fight for freedom. He ordered that the phrase "freedom or death" be inscribed on that flag. Meanwhile, mass protests have rocked Haiti on what would have been their National Flag Day celebrations. Police in armored patrol vehicles were deployed to quell hundreds of demonstrators using tear gas to disperse the crowd. Protesters are upset over fuel shortages, high inflation, and corruption. They are also accusing the government of using COVID-19 as a smokescreen to continue what they call their illegal occupation of office and to discourage people from mobilizing. Now to Ecuador, where social organizations have taken to the streets to protest against the government and its austerity measures during the pandemic. Workers, students, and other organizations protested in the capital, Quito, against a new law approved by the National Assembly. They reject that the law includes dismissal of labor laws and that we're protecting workers from massive layoffs. Meanwhile, the former director of risk assessment, Alexandra Ocles, has given her statement during a trial against her for alleged corruption. She's accused of approving an overpriced government food aid for those affected by the lockdown due to the COVID-19 pandemic. This adds to several authorities from the Lenín Moreno government under investigation for profiting off the pandemic. And now to Bolivia, protesters in the city of El Alto on Sunday night blocked the main highway to demand food and democratic elections in the country. The protesters were demanding that the de facto government steps down and allow the country to hold elections immediately. They have accused it of failing to address the social and economic challenges that the people are facing due to the pandemic. Similar protests took place in North Potosí and Yapacaní.
We want to tell the president that they're killing us with hunger. We no longer have anything to eat. Yes or no, compañeros? For that reason, we want this quarantine to be lifted immediately, and we demand the resignation of Murillo and others, those who authored the coup. What we want is immediate elections. We, El Alto, are self-convoked. We are not being obligated to be here by any neighborhood association or anyone. We ourselves, because we are hungry, have decided to come out. That's why we are here. El Alto on its feet, never on its knees.
We demand that the Supreme Electoral Court put forward an electoral calendar respecting the political constitution of the plurinational state of Bolivia, which according to the law must be held within 90 days. If this is not respected, we will be obliged to mobilize throughout the country, which will be announced under a new declaration. We are giving notice to all municipal, departmental, and national authorities that we are giving a deadline of 72 hours in which this must be fulfilled.
We move to Africa now. Cuban doctors who are in South Africa to help the country fight the COVID-19 have started working in various hospitals. The first group has already arrived in the Northwest province, while the other medical experts are still finalizing orientation training on the South African situation before they can be deployed to other health facilities in the country.
Of the 13 healthcare professionals, 8 are family physicians. Of the family physicians, 4 is allocated to the Bajanala districts, and 2 to the Kenneth Kaunda district, and 1 each to the RSM and NMM district. In Bajanala district, being the epicenter of our epidemic in Northwest province, they will be distributed between the Rustenburg area and the Madibeng sub-district.
Also in South Africa, the Association of Mining and Construction Workers Union has called on the government to enforce strict regulations to protect workers from unnecessary layoffs. The union said it is regrettable that a number of mining companies are using the COVID-19 pandemic as an excuse to dismiss employees without following the country's labor laws. Campaigning for Burundi's general election goes into full swing. General Evariste Ndayishimiye will be the ruling party's candidate, replacing outgoing President Pierre Nkurunziza. The elections will be held on Wednesday. The forces of the Libyan government of national accord have captured the strategic Al-Watiya airbase from fighters loyal to General Khalifa Haftar. Military spokesman Mohamed Nunu posted on his Twitter account that GNA forces had taken over the entire base near the Tunisian border and seized large quantities of ammunition belonging to Haftar fighters. A giant statue of Burkina Faso's revolutionary icon Thomas Sankara has been reinstalled in the capital, Ouagadougou, after modifications were made to improve its likeness to the former president who was assassinated in 1987. The statue was taken down just one day after it was originally unveiled in March 2019, amid criticism of its lack of resemblance. Sankara, an icon for many young Africans in the 1980s, came to power in 1983 and adopted left-wing policies and endeavored to reduce government corruption.
The first time I was indeed shocked to see the image because it didn't look like him at all. In any case, this time round the image is right. Every human creation is imperfect, and we believe that with all the activity there has been around the personality of Thomas Sankara, when the memorial is complete, we will have a true portrait of him.
We have more stories coming up. Stay with us. Thank you for joining us again. Iran's foreign ministry has warned the U.S. government of repercussions if it intercepted Iranian fuel shipments destined for Venezuela. The ministry said plans by the United States to block the shipment amounts to piracy and a threat to legal international trade. It added that the countries are sovereign nations that have the right to trade with each other. U.S. officials have threatened to intercept 5 Iranian ships that are currently on their way to Venezuela. And China has pledged $2 billion towards economic recovery and social development in COVID-19 affected nations, particularly developing countries.
China will provide $2 billion over 2 years to help with COVID-19 response with economic and social development in affected countries, especially developing countries. China will establish a cooperation mechanism for its hospitals to pair up with 30 African hospitals and accelerate the building of the Africa CDC headquarters to help the continent ramp up its disease preparedness and control capacity.
China is taking strict measures to control the spread of COVID-19 after new local cases were detected in the last weeks, raising alarms on a possible second wave of infections.
China is driving the resumption of school and economic activities, but the fears of a second wave of COVID-19 contagion have also increased. After the resurgence of local infection cases of the new coronavirus in the provinces of Jilin and Heilongjiang in the northeast of the country and in the city of Wuhan, this has forced the authorities to reactivate the emergency levels.
In response to the infection rates, the provinces of Heilongjiang, Jilin, and Hubei, the Joint Prevention and Control Mechanism of the Council of States, and the National Health Commission have recently sent out guidelines for the prevention and control of the pandemic in all local communities.
In order to stop the spread of the disease and maintain what has been achieved until now in the battle against the new coronavirus, China has announced new radical measures. All 11 million residents of Wuhan will undertake the nucleic acid test, and the quarantine was restored in several regions of Jilin and Heilongjiang.
We are conducting nucleic acid tests for all residents, which is a huge task in terms of social mobilization and organization. The main goal is to further identify the scope of the epidemic, to detect the virus in a proactive way, and intensify monitoring and detection.
Other actions to avoid new contagions will be maintained, including temperature controls, the use of a mask, the requirement of presenting digital health codes, among others.
Here in the city, we keep prevention measures, especially to return to work. It is very important to be safe, and that is why we use masks, we apply social distance, and the disinfection of the areas.
After more than 84,000 cases and almost 5,000 deaths, China takes a first step towards normality, but without abandoning prevention measures and seeking by all ways to avoid a second wave. The experiences of China can serve other nations that are now beginning the reopening after overcoming the worst stage of the outbreak.
Japan's economy has gone into a recession due to the coronavirus crisis. According to the Japanese government, the gross domestic product shrunk by 3.4% in the January-March period from the previous quarter. Japan was less affected by the virus compared to other developed economies, with just over 16,000 cases and around 750 deaths. But as the pandemic hit the global economy, the country's exports were among the worst affected, falling by 6% compared to the previous quarter. Italy has lifted most of the coronavirus restrictions for the first time after 2 months of lockdown. Various business institutions, churches, and recreational facilities have been permitted to open with strict requirements to adhere to safety rules. Italy is one of the countries worst affected by the pandemic, but it is following other European nations who have eased restrictions to curb the pandemic.
I've been used to going to church since I was a little girl, and after all that silence, which has become almost a spiritual silence, one feels the need to find a spiritual breath.
Venezuela is celebrating the National Day of Poetry, marking 100 years since the birth of Venezuelan poet, writer, and journalist Achilles Nazoa.
Achilles Nazoa was a prolific poet, narrator, and humorist who knew how to portray the struggles of the Venezuelan people and denounced the abuses of the powerful. The man known for his heartfelt description of Caracas. It was 100 years after his birth that the Venezuelan government declared National Poetry Day.
You have decreed the transformation of the presidential house in the Achilles Nazoa Cultural Center last December, and also decided to establish the day of the birth of Achilles Nazoa as the National Day of Poetry in Venezuela.
May 17, 1920, in the populous neighborhood of San Juan, the creator of Caracas, Física y Espiritual, was born. He obtained innumerable recognitions, among them the National Award for Journalism. He was also considered the poet of the people.
100 años cumple our beloved Achilles Nazoa turns 100 years. The poet, the writer, the translator of simple things of everyday poetry, of the beauty of life.
Humor and love are among the legacies of Achilles Nazoa. He's considered a point of reference for Venezuelan national identity, leaving a prolific work which today is part of the Venezuelan cultural legacy.
And with that, we end our news brief. But you can find these and many other stories on our website, telesurenglish.net. And be sure to follow health protocols where you are and stay safe. For Telesur English, I'm Carla Gonzalez. Until next time.